What's up everyone, Dr. Nate here. We are talking about when is pain okay with lower back pain. So assuming that you've ruled out trauma, so like a fracture, or you've ruled out an infection, cancer, Cotta-Equina syndrome. By the way, those are less than 2% of all cases. So assuming that that's you, this is the video for you. So let's say that you have back pain, it's been going on for a year, right? And you're still trying to figure out, like, when is this pain okay? Is this pain, like, am I gonna be damaging things more? And we're gonna go into that. So when people ask me the question of, I'm worried about making things worse, usually their concern is that they're going to make the pain worse and that it's going to decrease their function. So they won't be able to do the things they need to do, whether that is go to work or exercise or be with their family or just be able to sleep, right? Some people have difficulty sleeping as well. Maybe it's all of those things for you. So, and then what goes along with that is the belief that sometimes the pain itself means that more damage is happening, that there are specific tissues that are being damaged when pain levels are elevated. So let me just nip that off right now. In most cases, especially if you've had pain for a long time, there does not have to be more damage being done for pain levels to go up. So what can happen when we have had pain for a while is that our body actually gets more sensitive. And so yes, our pain levels go up, even like from doing simple things like bending over and walking for like 10 minutes, our pain levels can be through the roof. But that doesn't mean that structurally that more things are getting damaged. It means that for whatever reason, the nervous system itself is more irritated. It is possible that there are other structures being irritated, but once we've had pain for a year or longer, can happen earlier than that of course, but our nervous system itself can get very ramped up and irritated. So what does that mean? We don't want to say, okay, yeah, there's no tissue damage happening, but it still hurts a ton, and my problem is that I can't be hurting that much where I can't work or I can't take care of my family. So I made a video previously about pacing, right? Pacing yourself when it comes to activity, pacing yourself when it comes to exercise, and that's really important. So number one, you really do have to determine where is your threshold. And your threshold can change day to day, but there's a range of thresholds. And a way to do that is to stop doing some of the activities that you're doing, if possible, before symptoms get so severe that you have to stop. So stopping before symptoms get there versus pushing through it, because then you're just constantly in this flared up state. And then you can do that more often, right? So if you can only walk for 30 minutes before symptoms start to creep up, you can walk for 30 minutes, take a break, like go back home or whatever you need to do, and then if you want to get a whole hour in that day, you can actually just go for 30 minutes later in the day. It doesn't have to be all at one time. So you can break things up throughout the day so you're still able to do the same amount, but you're not jamming it all together. This happens also if you're like in physical therapy right now or doing some sort of exercise routine. You don't have to do it all at once. Now, if you're trying to increase your fitness levels, that's different than manage pain levels. Yes, like you do want to do the whole workout together just to build up a stimulus, to build adaptations that you want muscularly. But for pain, it's okay to break the movements up throughout the day to minimize the amount of flare-ups that you have. So usually there's going to be some amount of pain that you have to tolerate. Usually the guideline that I give to people is make sure that your pain is tolerable, and that's going to be different for each person, and do not push past it. You want to get to the point where it's just, not even to the point where like you're like, oh gosh, I have to stop. You want to stop before you get there. So your threshold is below whatever that, I have to stop threshold is. So I hope that's helpful. It really does help if you internalize that and make sure that you pace yourself, because if you're constantly in this flare-up state where you're just going like this all the time, it's really frustrating. It can last a long time. So this is a really easy way to learn how your body responds to certain things and take a scientific approach rather than just like shooting everywhere and hoping that something works. Go ahead and like this video if this was helpful for you. Please subscribe to my channel if you want to see more videos like this. I would love to hear what videos you would like me to make, and I can pump those out for y'all. And make sure to join my Facebook group. You can click the link in the description below. It's all about lower back pain, how to make progress, and just how to build your overall fitness. I got a lot of mindset training stuff in there too. As always, stay strong, stay resilient, and I will catch you on the next video.